51. What is the primary action of parathyroid hormone, PTH, in bone metabolism? A. Increases calcium excretion. B. Stimulates bone resorption. C. Inhibits bone formation. D. Enhances calcium absorption in the gut. Answer. B. Stimulates bone resorption. Rationale. Parathyroid hormone, PTH, increases calcium levels in the blood by stimulating bone resorption, which releases calcium from bones. 52. Which of the following lifestyle modifications can help reduce the risk of osteoporosis? A. Avoiding all physical activity. B. Smoking cessation and alcohol reduction. C. Consuming a high-fat diet. D. Prolonged bed rest. Answer. B. Smoking cessation and alcohol reduction. Rationale. Smoking and excessive alcohol intake are major risk factors for osteoporosis, so cessation or reduction of these behaviors is essential in managing bone health. 53. Which of the following conditions is most commonly associated with osteoporosis in men? A. Chronic use of corticosteroids. B. Pregnancy. C. Polycystic ovary syndrome. D. Hyperthyroidism. Answer. A. Chronic use of corticosteroids. Rationale. Chronic use of corticosteroids is a known cause of secondary osteoporosis in both men and women by inhibiting bone formation and increasing bone resorption. 53. Which of the following conditions is most commonly associated with osteoporosis in men? A. Chronic use of corticosteroids. B. Pregnancy. C. Polycystic ovary syndrome. D. Hyperthyroidism. Answer. A. Chronic use of corticosteroids. Rationale. Chronic use of corticosteroids is a known cause of secondary osteoporosis in both men and women by inhibiting bone formation and increasing bone resorption. 55. What is a common side effect of bisphosphonates used in osteoporosis treatment? A. Gastrointestinal irritation. B. Increased bone formation. C. Weight gain. D. Decreased kidney function. Answer. A. Gastrointestinal irritation. Rationale. Bisphosphonates can cause gastrointestinal side effects such as irritation, nausea, and esophageal irritation. These medications do not cause weight gain or increased bone formation directly. 56. What is the goal of osteoporosis treatment? A. To increase bone resorption. B. To prevent fractures and improve bone density. C. To decrease calcium levels in the blood. D. To stimulate joint degeneration. Answer. B. To prevent fractures and improve bone density. Rationale. The primary goal of osteoporosis treatment is to prevent fractures by improving bone density and reducing bone resorption. 57. Which of the following is a major complication of untreated osteoporosis? A. Increased circulation. B. Osteoarthritis. C. Bone fractures, especially in the spine and hips. D. Elevated blood pressure. Answer. C. Bone fractures, especially in the spine and hips. Rationale. Untreated osteoporosis leads to weakened bones, which increases the risk of fractures, particularly in the spine, hips, and wrists. 58. What is the recommended daily calcium intake for postmenopausal women? A. 500 milligrams. B. 1,000 milligrams. C. 1,200 milligrams. D. 2,000 milligrams. Answer. C. 1,200 milligrams. Rationale. Postmenopausal women are recommended to consume 1,200 milligrams of calcium daily to support bone health and reduce the risk of osteoporosis. 59. What is a common diagnostic tool used to assess bone mineral density in patients at risk for osteoporosis? A. Electrocardiogram. B. DEXA, dual energy X-ray absorptiometry scan. C. MRI scan. D. Blood test. Answer. B. DEXA, dual energy X-ray absorptiometry scan. Rationale. The DEXA scan is the most commonly used method to assess bone mineral density and diagnose osteoporosis, helping to predict fracture risk. 60. Which of the following is the most common cause of secondary osteoporosis in women? A. Hypercalcemia. B. Long-term corticosteroid use. C. Excessive physical activity. D. High calcium intake. Answer: B. Long-term corticosteroid use. Rationale: long-term use of corticosteroids is a leading cause of secondary osteoporosis in both men and women, as it inhibits bone formation and increases bone resorption. 61. What is the most common type of fracture in individuals with osteoporosis? A. Hip fractures. B. Coles fractures. C. Vertebral fractures. D. Skull fractures. Answer: C. Vertebral fractures. Rationale: vertebral fractures are the most common fractures associated with osteoporosis, often occurring due to the compression of weakened vertebrae. 62. Which of the following medications is used to stimulate bone formation in osteoporosis? A. Raloxifene. B. Denosumab. C. Teriparatide. D. Alendronate. Answer: C. Teriparatide. Rationale: teriparatide, a form of parathyroid hormone, is used to stimulate bone formation in osteoporosis patients who are at high risk for fractures. 63. Which of the following is a risk factor for osteoporosis in postmenopausal women? A. Increased estrogen levels. B. Decreased physical activity. C. High calcium intake. D. Increased muscle mass. Answer: B. Decreased physical activity. Rationale: decreased physical activity is a significant risk factor for osteoporosis as it leads to weaker bones and lower bone density. 64. Which of the following is true about the use of estrogen therapy in osteoporosis management? A. It is used as a first-line treatment for men. B. It is used to increase bone resorption in postmenopausal women. C. It helps maintain bone density in postmenopausal women. D. It is contraindicated in all women. Answer: C. It helps maintain bone density in postmenopausal women. Rationale: estrogen therapy is used to help maintain bone density in postmenopausal women by preventing bone resorption and stimulating bone formation. 65. Which of the following foods is a good source of calcium? A. Leafy green vegetables. B. Red meat. C. White bread. D. Rice. Answer: A. Leafy green vegetables. Rationale: leafy green vegetables, such as kale and spinach, are excellent sources of calcium, which is essential for maintaining bone health. 66. What is the main purpose of a DEXA scan in the management of osteoporosis? A. To diagnose fractures. B. To evaluate muscle strength. C. To measure bone mineral density. D. To assess calcium absorption. Answer: C. To measure bone mineral density. Rationale: a DEXA scan is used to measure bone mineral density and assess the risk of fractures due to osteoporosis. 67. Which of the following is a complication of long-term corticosteroid use in osteoporosis? A. Increased bone density. B. Development of osteoarthritis. C. Bone fractures. D. Enhanced calcium absorption. Answer: C. Bone fractures. Rationale: long-term corticosteroid use can weaken bones, leading to an increased risk of fractures, particularly in the spine and hips. 68. What is the recommended lifestyle modification to reduce the risk of falls in individuals with osteoporosis? A. High-impact exercise. B. Avoiding all physical activity. C. Balance and strength training exercises. D. Prolonged bed rest. Answer: C. Balance and strength training exercises. Rationale: balance and strength training exercises can help reduce the risk of falls, which are a major concern for individuals with osteoporosis. 69. What is the primary risk associated with hip fractures in osteoporosis patients? A. Increased heart rate. B. Reduced mobility and independence. C. Increased risk of gastrointestinal bleeding. D. Increased risk of stroke. Answer: B. Reduced mobility and independence. Rationale: hip fractures are associated with a significant reduction in mobility and independence, as they can lead to long-term disability and complications in older individuals. 70. Which of the following is a contraindication for bisphosphonate therapy in osteoporosis? A. Heart disease. B. History of gastrointestinal ulcers. C. History of asthma. D. History of migraine headaches. Answer. B. History of gastrointestinal ulcers. Rationale. Bisphosphonates can cause gastrointestinal irritation, and individuals with a history of gastrointestinal ulcers may have an increased risk of complications. 71. Which of the following is a non-pharmacologic treatment for osteoporosis? A. Estrogen therapy. B. Weight-bearing exercises. C. Bisphosphonates. D. Parathyroid hormone. Answer. B. Weight-bearing exercises. Rationale. Weight-bearing exercises are a key non-pharmacologic treatment for osteoporosis as they help improve bone density and strength. 72. What is the role of calcium supplements in osteoporosis management? A. They inhibit bone resorption. B. They decrease bone formation. C. They provide the body with the calcium needed for bone strength. D. They replace estrogen therapy. Answer. C. They provide the body with the calcium needed for bone strength. Rationale. Calcium supplements provide the necessary calcium for bone formation and maintenance, which is crucial for managing osteoporosis. 73. What is the effect of smoking on bone health in osteoporosis? A. It enhances calcium absorption. B. It accelerates bone loss. C. It stimulates bone formation. D. It has no effect on bones. Answer. B. It accelerates bone loss. Rationale. Smoking accelerates bone loss by decreasing blood flow to the bones and reducing calcium absorption, thereby increasing the risk of osteoporosis. 74. Which of the following can reduce the risk of osteoporosis in postmenopausal women? A. Increased dietary fat intake. B. Increased physical activity. C. Increased caffeine intake. D. Increased alcohol consumption. Answer. B. Increased physical activity. Rationale. Regular physical activity, especially weight-bearing exercises, helps maintain bone density and reduce the risk of osteoporosis in postmenopausal women. 75. What is the impact of low estrogen levels on bone health in women? A. Increased bone resorption and decreased bone formation. B. Decreased bone resorption. C. Increased calcium absorption. D. Increased bone formation. Answer. A. Increased bone resorption and decreased bone formation. Rationale. Low estrogen levels, especially after menopause, lead to increased bone resorption and decreased bone formation, contributing to the development of osteoporosis. 76. Which of the following is a major function of osteoblasts in bone metabolism? A. To stimulate bone resorption. B. To produce new bone tissue. C. To break down bone tissue. D. To regulate calcium levels in the blood. Answer. B. To produce new bone tissue. Rationale. Osteoblasts are responsible for producing new bone tissue by synthesizing bone matrix and promoting mineralization. 77. Which of the following statements is true about bone remodeling? A. It only occurs in childhood. B. It is a continuous process that involves both bone resorption and formation. C. Bone remodeling only involves osteoblasts. D. Bone remodeling stops once bone growth is complete. Answer. B. It is a continuous process that involves both bone resorption and formation. Rationale. Bone remodeling is an ongoing process throughout life, involving both bone resorption by osteoclasts and bone formation by osteoblasts. 78. Which of the following factors can decrease the risk of fractures in individuals with osteoporosis? A. High-impact exercises. B. Low-calcium diet. C. Vitamin D supplementation. D. Prolonged bed rest. Answer. C. Vitamin D supplementation. Rationale. Vitamin D helps the body absorb calcium and plays a key role in bone health, which can reduce the risk of fractures in individuals with osteoporosis. 79. What is the role of osteoclasts in bone metabolism? A. To produce new bone tissue. B. To regulate calcium levels in the blood. C. To break down and resorb old bone tissue. D. To stimulate bone growth. Answer. C. To break down and resorb old bone tissue. Rationale. Osteoclasts are responsible for resorbing old bone tissue, a process essential for bone remodeling and maintaining calcium homeostasis. 80. Which of the following is a common side effect of hormone replacement therapy, HRT, in osteoporosis treatment? A. Weight loss. B. Risk of blood clots. C. Hair growth. D. Increased bone resorption. Answer: B. Risk of blood clots. Rationale: hormone replacement therapy, HRT, can increase the risk of blood clots, which is a known side effect that limits its use in some individuals. 81. Which type of exercise is most beneficial for individuals with osteoporosis? A. High-impact aerobics. B. Weight-bearing exercises such as walking and strength training. C. Yoga and flexibility exercises. D. Swimming and cycling. Answer: B. Weight-bearing exercises such as walking and strength training. Rationale: weight-bearing exercises like walking and strength training are most beneficial for improving bone density and reducing the risk of fractures in osteoporosis patients. 82. What is the most important modifiable risk factor for osteoporosis? A. Age. B. Family history. C. Smoking. D. Gender. Answer: C. Smoking. Rationale: smoking is a significant modifiable risk factor for osteoporosis because it accelerates bone loss and reduces bone formation, increasing the risk of fractures. 83. What is the effect of alcohol consumption on bone health? A. It increases bone density. B. It inhibits calcium absorption and promotes bone resorption. C. It stimulates osteoblast activity. D. It has no effect on bone health. Answer: B. It inhibits calcium absorption and promotes bone resorption. Rationale: excessive alcohol consumption can interfere with calcium absorption and increase bone resorption, both of which contribute to osteoporosis. 84. Which of the following is a non-pharmacologic intervention to prevent osteoporosis-related fractures? A. Hormone replacement therapy. B. Bisphosphonates. C. Balance training and fall prevention strategies. D. Calcium injections. Answer: C. Balance training and fall prevention strategies. Rationale: non-pharmacologic interventions, such as balance training and fall prevention strategies, can help reduce the risk of fractures in individuals with osteoporosis. 85. What is the role of calcium in bone health? A. It stimulates bone resorption. B. It inhibits bone formation. C. It is essential for bone mineralization and strength. D. It increases bone turnover. Answer: C. It is essential for bone mineralization and strength. Rationale: calcium is a vital mineral that supports bone strength by contributing to bone mineralization and structure. 86. Which of the following is a diagnostic tool for detecting fractures in osteoporotic bones? A. X-ray. B. Electrocardiogram. C. MRI. D. Bone density test. Answer: A. X-ray. Rationale: X-rays are commonly used to detect fractures, and they can help identify bone damage in individuals with osteoporosis. 87. How does exercise help in the management of osteoporosis? A. It increases bone resorption. B. It enhances bone strength and improves balance, reducing fall risk. C. It reduces calcium absorption. D. It decreases blood flow to the bones. Answer: B. It enhances bone strength and improves balance, reducing fall risk. Rationale: exercise, especially weight-bearing exercises, helps strengthen bones and improve balance, which can reduce the risk of falls and fractures in people with osteoporosis. 88. Which of the following can cause secondary osteoporosis? A. High calcium intake. B. Chronic corticosteroid use. C. Regular physical activity. D. Low vitamin D levels. Answer: B. Chronic corticosteroid use. Rationale: chronic use of corticosteroids can lead to secondary osteoporosis by reducing bone formation and increasing bone resorption. 89. Which of the following is an appropriate treatment for osteoporosis in postmenopausal women? A. Parathyroid hormone, PTH, therapy. B. Estrogen replacement therapy, ERT. C. Insulin therapy. D. Steroid therapy. Answer: B. Estrogen replacement therapy, ERT. Rationale: Estrogen replacement therapy, ERT, is often used in postmenopausal women to prevent bone loss by maintaining bone density and preventing osteoporosis. 90. What is the primary concern with untreated osteoporosis? A. Increased bone density. B. Increased fracture risk. C. Decreased calcium absorption. D. Increased bone formation. Answer: B. Increased fracture risk. Rationale: untreated osteoporosis leads to weakened bones, making individuals more susceptible to fractures, especially in the spine, hip, and wrist. 91. Which of the following factors increases the risk of developing osteoporosis? A. Regular physical activity. B. High body mass index, BMI. C. Family history of osteoporosis. D. Adequate vitamin D levels. Answer: C. Family history of osteoporosis. Rationale: a family history of osteoporosis is a known risk factor, as genetic factors can contribute to bone density loss and increased fracture risk. 92. What is the role of weight-bearing exercise in osteoporosis prevention? A. It reduces bone mass. B. It stimulates bone resorption. C. It helps increase bone density and strength. D. It inhibits bone formation. Answer: C. It helps increase bone density and strength. Rationale: weight-bearing exercises, such as walking, jogging, and strength training, help stimulate bone formation and increase bone density, reducing the risk of osteoporosis. 93. Which of the following is a complication associated with osteoporosis in the elderly? A. Increased mobility. B. Reduced risk of falls. C. Increased risk of fractures due to weakened bones. D. Improved lung function. Answer: C. Increased risk of fractures due to weakened bones. Rationale: in the elderly, osteoporosis leads to weakened bones, which significantly increases the risk of fractures, especially in the spine, hips, and wrists. 94. How does aging contribute to osteoporosis? A. Increased calcium absorption. B. Decreased bone resorption. C. Reduced bone density due to hormonal changes and slower bone remodeling. D. Increased muscle mass. Answer: C. Reduced bone density due to hormonal changes and slower bone remodeling. Rationale: as individuals age, hormonal changes such as reduced estrogen in women and slower bone remodeling contribute to reduced bone density and increased risk of osteoporosis. 95. What is a common treatment option for preventing osteoporosis-related fractures? A. High calcium diet only. B. Bisphosphonates to inhibit bone resorption. C. Antibiotics. D. Glucocorticoids. Answer: B. Bisphosphonates to inhibit bone resorption. Rationale: bisphosphonates are commonly prescribed to inhibit bone resorption, increase bone density, and reduce the risk of fractures in individuals with osteoporosis. 96. Which of the following foods is a rich source of vitamin D? A. Salmon. B. Bananas. C. Spinach. D. Apples. Answer: A. Salmon. Rationale: salmon is a rich source of vitamin D, which is crucial for calcium absorption and bone health. 97. Which of the following statements about osteoporosis is true? A. Osteoporosis only affects women. B. Osteoporosis is a normal part of aging. C. Osteoporosis causes pain and swelling in the bones. D. Osteoporosis increases the risk of fractures. Answer: D. Osteoporosis increases the risk of fractures. Rationale: osteoporosis is a condition that weakens bones, increasing the risk of fractures. It is not exclusively a disease of aging, nor does it directly cause pain or swelling in bones. 98. Which of the following medications is commonly used to treat osteoporosis in postmenopausal women? A. Antihypertensives. B. Bisphosphonates. C. Beta blockers. D. Antidepressants. Answer: B. Bisphosphonates. Rationale: bisphosphonates are widely used to prevent bone loss and reduce the risk of fractures in postmenopausal women with osteoporosis. 99. What is the primary goal of osteoporosis treatment? A. To promote weight loss. B. To increase bone density and prevent fractures. C. To decrease muscle mass. D. To reduce blood pressure. Answer. B. To increase bone density and prevent fractures. Rationale. The primary goal in treating osteoporosis is to increase bone density and reduce the risk of fractures by improving bone strength and preventing further bone loss. 100. Which of the following can be a sign of advanced osteoporosis? A. Sudden weight gain. B. Painful joints. C. Spinal deformities such as kyphosis. D. Increased energy levels. Answer. C. Spinal deformities such as kyphosis. Rationale. Advanced osteoporosis can cause spinal deformities like kyphosis, a curvature of the spine, which often leads to pain and height loss.